They won't tell you this at your regular doctor's visit, but let me be blunt. If you've stopped masturbating in your later years, your body might already be breaking down, and you probably don't even know it. No, this isn't some taboo topic or locker room nonsense. This is real, clinical, physiological truth. And the consequences of ignoring this truth can be devastating, not just to your sexual health, but to your brain, your heart, your sleep, your immune system, and even your sense of self. My name is Dr. Elena. I'm a urologist and men's health specialist with over 30 years of experience working with aging patients across the country. I've spent my career studying how the body changes as we grow older, especially when it comes to intimacy, hormones, and long-term vitality. And one of the biggest silent threats I've seen is this. Too many older men abandon their sexual health, and with it, a major key to their overall well-being. Here's what may surprise you. Masturbation isn't just a leftover impulse from your younger years. It's actually one of the most powerful tools your aging body still has to regulate your hormones, boost your brain, protect your prostate, and even fight off depression. And if you've stopped, the price you're paying might be far higher than you think. In the next few moments, I'm going to walk you through exactly what happens inside your body when you stop masturbating in old age. And what I share may completely change how you look at your health and yourself from this moment forward. Before we get started, if you care about staying sharp, healthy, and independent as you age, go ahead and subscribe and turn on the bell so you never miss important advice tailored just for you. And if this message resonates with you, type 1 in the comments. If not, type 0. Your feedback helps me create content that truly supports your health and well-being. Now, let's begin with the first and perhaps most overlooked consequence: what it quietly does to your prostate and urinary health. 1. Decreased prostate health and urinary function. When I first began practicing urology over 3 decades ago, I didn't expect so many of my patients to open up about something so private, yet so critical to their health: the quiet disappearance of sexual habits in their later years. One man I remember clearly sat across from me and said, "Dr. Elena, I just figured I didn't need that part of life anymore." He was in his early 70s, fit, sharp, but he'd been waking up 4 or 5 times a night just to use the bathroom. What he didn't know is that regular ejaculation, even through masturbation, plays a crucial role in keeping the prostate functioning properly. The prostate is not just some passive gland. It's a living, dynamic organ that produces fluid, expands, and contracts. And like any system, it suffers when neglected. Without regular stimulation and release, prostate fluid can stagnate. That stagnation creates the perfect environment for inflammation, swelling, and eventually the kind of pressure that disrupts everything from urination to sexual performance. You might feel it as a heavier bladder, weaker stream, or uncomfortable fullness. These aren't just annoyances. They are early warnings. Chronic prostate congestion can quietly escalate into benign prostatic hyperplasia, or BPH, which affects nearly 50% of men over 60. Left unchecked, it can lead to urinary retention, bladder infections, and even the need for catheterization. That same man eventually needed surgery, something that might have been avoided through simple, consistent habits. Regular ejaculation helps flush out the prostate, clear out old fluid, and reduce the risk of buildup. Studies have shown that men who ejaculate 21 times or more a month are significantly less likely to develop prostate cancer. And let me be clear, this is not about fantasy. This is about function, about using your biology to protect your body in the simplest, most natural way possible. I've had patients who've become afraid to leave their homes because they don't trust their bladder. I've seen strong men reduced to sleepless nights and anxiety over a condition that might have been prevented with regular self-stimulation. Losing control of your body in this way eats at your sense of independence. It's not just about your prostate, it's about your freedom. 2. Cognitive fog and reduced mental clarity. Not long ago, a patient in his late 60s came to see me. He said, "Dr. Elena, I don't feel like myself anymore. I walk into a room and forget why I'm there. I lose my train of thought. I used to be so sharp. Is this just old age?" What most men don't know is that sexual activity, including masturbation, plays a powerful role in protecting brain function. When you engage in self-pleasure, your brain releases dopamine, serotonin, oxytocin, all directly linked to memory, focus, and emotional regulation. These chemicals help build and protect neural connections, stimulate blood flow to the brain, and reduce cortisol, the stress hormone that damages brain cells. When you stop masturbating, especially over a long period, those natural brain protective chemical surges become less frequent. Over time, this can dull your mental edge. You may find it harder to concentrate, process information, or feel motivated. It doesn't happen overnight. First, you forget names. Then you forget what day it is. Then you start to doubt your mind entirely. In men, there's an added hormonal shift. Testosterone, deeply tied to memory, decisiveness, and vitality, can decline faster when sexual activity drops to near zero. Frequent, healthy ejaculation can help regulate and preserve testosterone levels as you age. Some studies have begun linking reduced sexual activity in older adults to early signs of cognitive decline, even dementia. When the brain is deprived of stimulation, emotional release, and hormonal support, it becomes more vulnerable. It loses its rhythm, its resilience. One man told me he stopped going to his chess club because he couldn't focus anymore. Another said he felt blank every morning. These weren't memory problems requiring medication. They were symptoms of a life disconnected from physical intimacy, even with oneself. And here's the tragic part. These are avoidable. Sometimes it starts by reconnecting with your body, giving it the attention it craves. Because when you stimulate the body, you awaken the brain. 3. Heightened depression and emotional numbness. I once had a patient in his early 70s, a widower, who came to me and said, "I don't feel anything anymore. Not sadness, not joy, just flat. Is that normal for someone my age?" That question echoes in my mind because what many assume is simply aging, the dullness, the disconnection, often has a deeper cause: the loss of sexual stimulation. When you stop engaging with your own body intimately, your emotional landscape can shift in profound ways. Masturbation is not just a physical act. It's an emotional release, your body's built-in stress relief system. During climax, the brain releases oxytocin and endorphins, natural mood stabilizers that combat anxiety and low mood. When you remove that release from your life, especially during stress, loneliness, or grief, you risk becoming emotionally numb, and that numbness can evolve into depression. I've seen it unfold slowly. Someone stops masturbating after losing a partner or thinking it's no longer age appropriate. Weeks turn into months. They become quieter, withdrawn. They lose interest in hobbies, conversation. Life starts to feel gray, and most don't realize the connection. Depression in older adults doesn't always show up as sadness. Sometimes it's fatigue, irritability, detachment, or absence of motivation. One man told me he felt alive again after beginning to touch himself regularly for the first time in years. He said it reminded him that he was still a human being, not just a body waiting to shut down. Masturbation in later life isn't about fantasy or shame. It's about keeping your emotional system healthy, giving your body a reason to feel, to release, to remember what it means to be present. Because when you lose that connection, you're not just risking sadness. You're risking isolation, emotional atrophy, and the very will to engage with life. 4. Poorer sleep quality. I remember a man in his late 60s who came to me after months of poor sleep. "Dr. Elena," he said, "I fall asleep, but I wake up at 2 a.m. like I've been shot out of a cannon. Then I just lie there waiting for morning." We ran tests. Everything was clean. But when I asked about his intimate life, he looked away. That part of me is over. But that part of him was possibly the very key to what his body was crying out for: restorative sleep. One of the most effective natural triggers for deep sleep is orgasm. During climax, your body releases oxytocin, prolactin, endorphins, a chemical cocktail designed to shift the nervous system from stress to rest. Cortisol drops sharply, your breathing slows, heart rate steadies, muscles relax. You enter the ideal state for deep sleep. When older men stop masturbating, the body loses this natural tool. What fills the gap is often restlessness, tossing and turning. Some turn to sleeping pills, others accept exhaustion as normal. But poor sleep weakens the immune system, accelerates cognitive decline, raises heart disease risk, and increases vulnerability to anxiety and depression. Masturbation may seem trivial, but it can be the difference between 4 hours of fragmented sleep and 7 hours of deep, healing rest. One patient told me after reconnecting, "I sleep like I did 30 years ago. I thought I was just getting old." Too many men mistake biological neglect for aging. If you're lying awake at night, mind racing, ask yourself, when was the last time your body felt fully relaxed? Sometimes the answer isn't a new medication. Sometimes it's about rediscovering an old rhythm your body still remembers. 5. Weakened pelvic floor and blood circulation. Several years ago, I treated a retired firefighter in his 70s, complaining of mild urinary leakage and difficulty standing without discomfort. "I feel like the foundation of my body is giving out," he said. What he was describing was the quiet weakening of his pelvic floor. The pelvic floor is a group of muscles supporting your bladder, bowel, and sexual organs. Most men don't think about these muscles until something goes wrong: urine leakage, erectile dysfunction, or discomfort when standing. Regular sexual stimulation, including masturbation, plays a major role in keeping those muscles active. During arousal and orgasm, the pelvic floor contracts rhythmically. That contraction improves blood flow, strengthens the internal support system, and keeps nerves and muscles communicating. It's not about performance, it's about preservation. When you stop masturbating regularly, those muscles atrophy. Blood flow slows, tissue becomes less elastic, nerve response fades. Eventually, you struggle with frequent urges to urinate, dribbling, difficulty holding gas, or pain during movement. For men, this means a dramatic drop in sexual function. I've seen once independent men avoid social outings because they don't trust their bladder. They become embarrassed about leaks, not knowing this traces back to neglected circulation and muscle activity. Ignoring this area can lead to falls, incontinence, and loss of dignity. You might start relying on pads or bathroom proximity planning, all because your body isn't getting the stimulation it needs. Your body still wants to function, even at 70, 80, or beyond. One of the most effective natural ways to support it is through safe, regular, intimate stimulation. When you reclaim that connection, you're restoring strength, sending blood where it's needed, waking up nerves, and reminding your lower body that it still matters. 6. Lower immune function. A few winters ago, one of my longtime patients came in looking drained. He'd been sick 3 times that season with lingering colds. "I used to bounce back in a day or two," he said. "Now every little bug knocks me out for weeks." When we ruled out the usual suspects, I asked about his intimate life. He shook his head. "Nah, not for a long time. That part of me is retired." What he didn't realize is that sexual activity, including masturbation, directly impacts the immune system. During orgasm, your body produces immune-enhancing agents. Immunoglobulin A, or IgA, rises significantly. This key antibody helps defend against viruses, bacteria, and infections. Endorphins are also released, reducing inflammation and supporting healing. When you go without that boost for months or years, your body loses one of its easiest, most natural defenses. In a time when your immune system is already slowing down, taking away this mechanism is like pulling the batteries from your smoke detector. Patients who've shut down their intimate lives often get sick more frequently, recover more slowly, or experience chronic inflammation. The immune system is tied to long-term disease prevention, cancer surveillance, cardiovascular protection, even wound healing. Regular sexual release helps maintain hormonal balance, reduce cortisol, and increase circulation. One man in his 70s, after reconnecting, told me, "I just feel more alive, like my body is working with me again." That's what happens when the body gets the signals it needs, signals that say, "We're still here, we still want to thrive." 7. Loss of body ownership and self-worth. I'll never forget a patient in his late 70s, a retired school principal, once confident and quick-witted. When he came in, something had changed. He sighed and said, "I don't really feel like I live in this body anymore. I feel like I'm just inhabiting it." What he described isn't uncommon. Somewhere along the way, men stop feeling at home in their own skin. And too often, it starts with giving up self-intimacy, brushing it off as no longer necessary or too late in life. Self-touch isn't just about pleasure, it's about presence. When you stimulate your body, even gently, you remind your nervous system that you are still here, that you matter, that your body is still part of your identity, not just a vessel you're waiting to leave behind. Without that, emotional and psychological distance forms. It becomes easier to ignore aches, stop looking in the mirror, believe this chapter isn't worth nurturing. And that is the most dangerous loss of all, the loss of your own sense of worth. I've seen this disconnection lead to emotional numbness, shame about aging, withdrawal from affection, loss of motivation for self-care. Men stop exercising, eating well, dressing with intention. Why bother, they think, when this body no longer feels like mine? One man told me, the less I touched myself, the more I disappeared. That's exactly what happens. Men don't just lose pleasure, they lose identity, visibility, aliveness. It doesn't have to be this way. Reclaiming your body through self-touch isn't about being sexual like at 20. It's about honoring the life still present in you. It's about saying, I'm still here, I still feel, I still deserve to be seen, even by myself. When you reconnect with your body, you reverse that quiet erasure. You remind yourself that aging is not vanishing, that your worth didn't expire with your youth. You come home to yourself again, and that is the most healing act of all. Final thoughts. Reclaiming intimacy, reclaiming health. Looking back over the years I've spent caring for aging men, what strikes me most are the quiet, invisible losses they carry. Losses that don't show up in lab results. A man who used to feel confident now avoids mirrors. Another says he hasn't felt anything in years, and they've been told this is simply what getting older looks like. But I don't believe that. The moment you stop caring for your sexual self, the moment you abandon that part of your body and identity, a chain of quiet consequences begins. We've talked about them, how prostate and urinary health decline, how the brain grows foggy, how absence of intimacy invites depression, dulls sleep, weakens circulation, and compromises the immune system. And most painful of all, how giving up that connection slowly chips away at your sense of worth. These are not small things. These are not just a part of aging. These are warning signs that your body, mind, and spirit are asking for your attention. I've sat across from men who felt broken, disconnected, numb, and I've seen the transformation when they begin to reclaim this part of their life. It doesn't require anyone else. It doesn't demand youth or perfect health. It only requires permission. Your permission to see yourself as worthy of intimacy, even now, especially now. Masturbation in later life isn't about indulgence. It's about circulation, clarity, hormonal balance, emotional grounding, immune defense, and identity. It's not a luxury. It's a form of care, a declaration that you are still alive in this body and still responsible for its well-being. One patient once told me, I didn't realize how much I missed feeling like myself until I finally touched that part of me again. That's what this is about. Not just staying alive, but feeling alive. Not just surviving the years, but inhabiting them with presence, dignity, and joy. So if you've forgotten this part of you, or buried it, or judged it, I invite you now to reconsider, to reconnect, to remember that your body is still listening, still capable, still deserving. Start small, with curiosity, with kindness, but most importantly, start. Because in choosing to care for this part of yourself again, you're not only protecting your health, you're reclaiming your life. If this message resonated with you, don't keep it to yourself. Like this video, share it with someone who might need to hear it, and leave a comment below. Your voice matters, and your story might help someone else feel seen. Remove these words.